Everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to take a look at some of the best things that you can do to prepare your home environment for your return after knee replacement surgery. Everyone, so today we're talking about how to prepare your home environment for knee replacement surgery and returning home after your knee replacement surgery. We'll talk about kind of the main important ones. The main things are probably the bathroom and the bedroom. First of all, we'll talk about the bedroom. So with the bedroom, if you can, you really want to consider having the setup of a bed or a bedroom or a temporary bedroom on the first floor if possible. This will help you with not having to go up and down the stairs as much. This can be something that's a little bit difficult. Totally possible to do right after surgery, but definitely is a little difficult and a little painful in those first few days after your knee replacement surgery. So having a first floor setup can be really helpful. You want to make sure that you have things within reach, things that are nearby that you might need. Your alarm clock, your phone, whatever it may be, chargers, things like that. You want to make sure that you're able to get in and out of the bed okay. If you have a bed that's a little bit higher, maybe putting a stool there and having that available. So for when you come home, sometimes you might even want a bed rail if it's something that you're really having difficulty prior to surgery getting in and out of bed. You might want to have that bed rail available to give you a little extra hand getting in and out of bed after surgery as well. Also for the bed, you really want to consider your positioning and comfort in bed. So things like having a lot of pillows available is great. You can also have a wedge or a wedge pillow. A lot of people get a lot of benefit and use out of a wedge pillow to help elevate your legs when you're sleeping or resting. And also people tend to really like the full body pillows, the full body length pillows to help if you want to sleep on your side or in different positions after you come home from surgery. So that's the bedroom. You also want to look at the bathroom. So again, if you can have a bathroom on the first floor, that's going to be the best so you don't have to manage so many stairs, or especially early on those first few days. You want to think about making sure that your toilet seat is high enough. So sometimes people have very low toilet seats. They might be difficult to get on and up, down and up and down from. And so you might want to consider having an elevated toilet seat, or you can get a commode and put the commode, take the bucket part out and actually just put the commode over your toilet seat to elevate it a little bit that way, and also give you some handrails to hold on to. Or just make sure that your toilet seat is high enough that you can get on and off of it okay, especially those early days after surgery again. And another thing with the bathroom is just make sure maybe if you're showering or bathing, having a seat or a bench can be really helpful. So if you have a lot of trouble just standing up that long, you obviously, the first couple of days, you have to be careful with showering or soaking the incision, and you want to talk to your surgeon about that and follow their instructions. But having a seat or a bench can sometimes be really helpful with showering after surgery, as well as a handheld shower nozzle as well. Some other things is you want to think about just general equipment to have. So you want to have some sort of method, some sort of machine for icing. Icing is going to be a huge part of your first few days and first few weeks after surgery, especially. You want to have a walker, possibly a rolling walker, or maybe even a cane available just for those first few days. Again, being able to walk comfortably and get where you need to get to. You might want to also consider having some really loose fitting clothing that you can put on, or some comfortable socks. Some non-skid socks with the little grippies on them are really beneficial and helpful, help you not skid and slide around as easily. And just having comfortable clothing to wear. You're going to have a lot of swelling, you're going to have some difficulty moving around. So having some comfortable clothing, some comfortable if it's sweatpants or shorts or capris, whatever it may be. And also just be prepared for things like preparing meals. So maybe you have family members or some people who can help you out with that, or you might want to prepare some meals beforehand so you have a couple of meals that you can just heat up easily and not have to deal with that much stress and strain and being on your feet, especially that first couple of days or week after surgery. So these, I would say, would be my top recommendations and top things to think about when you prepare your home. There's definitely some other things out there and some other things that I'm sure that some of you have done and did to prepare yourself for your surgeries and that you found really helpful and really beneficial. As always, make sure you have some social supports, can really go a long way. If you have family that you live with, of course, but also maybe if you live alone, having a neighbor or a friend or a family member nearby that can check in on you maybe once a day or so, help you out if needed, if you need rides somewhere. That can be really helpful and really beneficial, especially those early days after your surgery. So thank you very much for watching, everyone. As always, I encourage you to subscribe if you like our content and get some useful information from these videos. And thank you very much for watching, and have a great day.